Hello everyone, I am Dr. Simone Atkinson from Get to the Point Nursing Notes. Today we're diving into the symptoms of Parkinson's disease. So, let's get to the point. Parkinson's disease is a progressive, degenerative neurologic condition that affects many older adults. And this disease is all about the brain's dopamine levels. Parkinson's leads to a depletion of the dopamine, which usually inhibits norepinephrine, and as a result, excitatory impulses go haywire, and they affect the extrapyramidal system. When this happens, the classic symptoms start popping up: bradykinesia, which are the slow movements, muscle rigidity, and non-intentional tremors. The usual clients for this condition are the older adults, and they're typically diagnosed between the ages of 50 and 60. And as time goes on, Parkinson's progressively interferes with their movement and self-care, and it increases the risk of falls and can even lead to depression. So imagine this. Your patient feels tired all the time and starts showing a slight resting tremor in their hands and their fingers, and we call it pill rolling. And those tremors ease up when they move around or they catch some sleep, but the tremors will start back when they're tired. Probably you recall the term bradykinesia is just a fancy term for slow movements caused by tight muscles, and it might affect their face, their mouth, and their voice. So they might have a blank staring glare, difficulty speaking and swallowing, as well as they could have drooling and their speech could sound monotonous. Postural trouble is also normal in these patients, and they might lean forward and have some wild, uncontrolled movements. And their walking style might change too, being short-stepped and shuffling, which means more falls are probably on the way. And what is interesting is that they might be sweating buckets on their face and their neck, but not so much on the rest of their body. Constipation, this is another common hurdle too, slowing down their visits to the bathroom, and they are an emotional roller coaster. Anxiety and depression might start messing with their mood, plus they might have some restless nights with sleep disturbances. Now let's dive into the therapeutic management strategies for Parkinson's disease. We've got medications, surgery, and rehabilitation to optimize our patient's functional level. But remember, it's a team effort, and a collaborative approach is key to providing top-notch quality care. So moving on, we want to make sure we keep these clients moving and grooving. So we need to encourage them to perform active and passive range of motion exercises. And don't forget to get them up and ambulating frequently so that we avoid them sitting for long periods of time. Teach them to lift their feet when they're walking and keep their chin up so that they have a better visual field. And this can also prevent them from falling. And a pro tip, when they're trying to get up, use that rocking motion, because rocking can make standing up easier for them. So we want to assess their communication skills, including speech, hearing, writing, and we want to keep in mind that as the disease progresses, these skills may become progressively smaller, making it challenging for our clients to express themselves effectively. So if we notice any issues or concerns, it's essential to consult with a speech pathologist for specialized support. Next, let's focus on the nutrition. We need to assess their nutritional status to ensure they're getting the right nutrients to stay healthy. And when it comes to feeding, we want to see how well they can feed themselves independently. For their diet, we want to promote a soft diet that's high in protein, fiber, and calories, because this will help them maintain their energy levels and their overall well-being. To make things easier on their digestive system, we can divide their meals into smaller, more frequent portions. And don't forget about hydration. We want to ensure they're drinking enough fluids, around 2,000 milliliters per day, in order to stay well hydrated and to support their body functions. When it comes to assistive devices, think about using Velcro and slip-on shoes for convenience, and work on maintaining their posture. Teach them to hold their hands behind their back to keep their neck and spine straight, and have them lie prone regularly without a pillow to help with their posture too. Lastly, medication therapy plays a crucial role. We've got MAO inhibitors, dopaminergics, dopamine agonists and anticholinergics to help manage their symptoms. But keep in mind, over time, some drugs might lose effectiveness, and this will result in a fluctuating response called an on-off response in our Parkinson's patients. Also, antidepressants like amitriptyline can treat depression, and propranolol might come in handy for their tremors. First and foremost, we want to focus on preventive measures. We need to keep an eye for potential malnutrition issues, so encourage our clients to maintain a well-balanced diet. Falls can be a significant concern, so educate them on environmental hazards and how to prevent falls. Constipation, another hurdle, so let them know about dietary and lifestyle changes that can help. And we mustn't overlook skin breakdown from incontinence or joint contractures. Both require special attention in our care. And moving on to gait training and exercises, these are like the superpowers for Parkinson's patients. Gait training can significantly improve their ability to walk, while exercises will target ambulation, swallowing, speech, and their self-care skills. So with consistent practice, they can make remarkable progress. All right, you're now armed with the knowledge to provide top-notch care for our Parkinson's patients. If you found this video helpful, smash that like button and subscribe to the channel, and we'll see you in the next video.